of mothers. And I began this organization last October when I realized the situation in the public schools where our children were being indoctrinated under a liberal agenda. That's all I'm going to say that's in any way political. However, on August 28th of this year, we're having an event in Washington, D.C. with Michelle Malkin as our keynote speaker. And if you're interested, there are brochures over in the other building during the reception. But let's go back 20 years. It was 1990, and I was 3 years into a new position as the Senior Administrative Assistant to the President and CEO of GE Medical Systems. GE Medical was a medical device manufacturer, CAT scanners, MRIs, that type of equipment. Not only did we manufacture them, but we serviced them as well. One night around 7 p.m., I was halfway through the door when my phone rang. My parents taught me a great work ethic, so I turned around and I answered that phone, even though I was just dying to go home. And on the other end of the line was a hospital. Apparently, our equipment had broken down in the middle of a procedure, and the panicked person on the line was for some reason unable to find their service person's phone number. Within minutes, I was able to contact the VP of service. He contacted the service person, and they arrived at the hospital, and all of this took place in under 15 minutes. But I could have been faster. I would have been faster had I had direct access to the service personnel list from basically around the world where all our equipment exists. I could have called them directly and carved minutes off that time, and after the event I wondered, what if I had not answered that phone? What if they called someone else who didn't know where to start? And what if something went wrong in the hospital room as the minutes ticked by? That's when I established a team of coworkers, and we began a training program for employees that might, like I did, get a call that's misplaced, gone astray, and be able to actually help. My point in telling you this story is this: when faced with things that can be life or death, we need to first learn and adjust the system to ensure the failure rate is greatly reduced. Creating this documentary is the first step in spreading this awareness. Now we need to work together to adjust the system to ensure current and future physician job satisfaction. We need to bring it back to its proper place. Our children need quality medical care, and all these necessary adjustments to reduce physician failure rates is not something our government is doing. In fact, they're putting more and more restrictions in place to harm rather than help. I changed my speech a little on the way here on the plane because I was reading that really cool magazine called The Week. And they had just a tiny little blurb in there that said that due to the anger over this healthcare bill, 47 physicians are running for House and Senate seats this November. 47. Currently, there are 16 doctors in Congress. And I don't know about you, but to my way of thinking, better doctors than lawyers. Nurse practitioner at Children's Hospital of Milwaukee. When she first entered college in 1990, that 1990 number seems to stick with me, she had the dream of medical school, and it only took her one semester and lots of chats with senior students to decide a nursing degree would be better. She came home at Christmas crying, and when I asked her why she wanted to switch, she stated, "I want to treat the person, not their body parts." I was shocked because I always felt my own physicians cared about me and were interested in my well-being as well as my body parts. But now things have changed. My doctors, while professional and concerned, whip me through their offices at the speed of light through no fault of their own. They sometimes look drained of energy and definitely frustrated. I had one doctor who lost 70 pounds from one physical to the other. And when I asked him how he did it, because I thought maybe he wasn't taking care of himself, he said, "I finally gave myself a break and exercised." I always leave there better health-wise, but I'm never quite sure how long it's going to be before I need them again, and I'm told that I need to wait a week or more. And as I age, like many of you, this concern deepens. So I asked my daughter recently the one question on my mind. Have you heard others at the hospital talking about the new healthcare bill, and what are they saying? She answered in 3 words. We are toast. It's not just the healthcare bill that will be the cause of longer waiting times and poorer quality. The government, while saying they want to reduce the cost of healthcare for everyone, is instead creating the double whammy. A further financial drain on our healthcare system on the backs of the taxpayers. They're concentrating on healthcare while jobs continue to be lost to all. Like I mentioned, as the president for Mom for America, we're concerned about the liberal agenda in the public schools. However, we're more concerned about our children's health. The administration's focus is not where it should be, and we need to bring our country back into balance, and that includes our healthcare system. Finally, it's an honor for me to be here to view this film and meet these fine people that were involved. The only reason I'm here is because I happened to get the film into the hands of Glenn Beck. I lucked out. I was on the show on May 18th, and it turned out that they were doing 2 filmings. So in one I was in the audience, and the other one I got to actually ask a question. And at the end, I managed to hand this film to him personally. But like I said, I'm honored to be here. We need to spread the awareness and adjust the system. Thanks for inviting me.
Next up.